Hi there. This is Kyle. Kyle's been living with moderate to severe atopic dermatitis, the most common type of eczema. This is Kyle's mom, Andrea. Today, we will discuss administration of your maintenance dose of Adbry, tralokinumab-ldrm. Your healthcare professional should show you how to prepare and inject Adbry using the prefilled syringes before you inject Adbry for your maintenance dose, which is one 150 mg injection. Even though you may have learned how to inject with your healthcare professional and practiced injecting with the demonstration training syringe in your welcome pack, your first time injecting at home might seem a little intimidating. Don't worry, Kyle and his mom are here to help you get familiar and confident with the process. They'll go over what supplies you'll need, how to choose and prepare the injection area, how to inject, and how to dispose of the used syringe. Before we keep going, it's important that you've carefully read the instructions for use that comes with your Adbry carton before injecting. If you haven't yet, pause the video and take a look. We'll keep going once you're done. If you have any questions, you can always contact your healthcare professional or the Adbry Advocate Patient Support Program at 844-MY-ADBRY or 844-692-3279. Let's get started. Before getting everything together, you'll want to have a clean surface for your supplies. Now, here's what you'll need. A nearby sink to wash your hands. A clean gauze pad or cotton ball. A sharps container. A small bandage. An alcohol wipe. If you don't already have a sharps container, you can get a free one by calling the Adbry Advocate Program at 844-MY-ADBRY or 844-692-3279. If you do not yet have a sharps container, do not throw your syringe or syringe cover away in a regular trash can. For now, you can use an upright household container, such as a coffee can or an empty laundry detergent container. It should be made of heavy-duty plastic, be able to close with a tight-fitting, puncture-resistant lid, and be leak-resistant. Label the container so you and anyone else who comes across it knows it has hazardous waste inside. When your container is almost full, follow your local guidelines on how to dispose of your sharps container. You can call your healthcare professional or visit the FDA website for more information. Take the Adbry carton out of the refrigerator. Check your carton's expiration date. Don't use if it's expired or if the seal is broken. Remove one pre-filled 150 mg syringe and place it on a tray 30 minutes before you are ready to inject to allow Adbry to warm up to room temperature. Each carton contains 2 pre-filled syringes. You can place the carton with the remaining syringe back into the refrigerator for your next dose. Never freeze your syringes or use syringes that have been previously frozen. Keep Adbry and all medicines out of the reach of children. Leaving the syringe on a flat surface, away from direct light for 30 minutes, can help reduce discomfort and make it easier to inject Adbry. Don't try to speed up this process by warming up the syringe in the microwave, under hot water, or in sunlight. It's important you don't shake the syringe, remove the needle cover until you're ready to inject, or put the syringe back in the refrigerator after it is warmed up. Now that your syringe is room temperature, check the syringe for a few things. Check the label and the expiration date. Make sure the syringe is not damaged in any way. Look through the syringe's viewing window. The liquid inside should look clear to slightly pearly and be either colorless or pale yellow. It should not look cloudy, discolored, or have particles. If you have any questions about whether the syringe is okay to use, give your healthcare professional a call before injecting the syringe, or call 844-MY-ADBRY or 844-692-3279. Now that you've inspected everything, it's time to choose where you'll inject. Andrea will be injecting for Kyle. As a caregiver, She has the option of injecting his upper arm, thigh, or stomach area, but not within 2 inches of the belly button. Today, Andrea and Kyle are choosing to inject Kyle's right upper arm. Make sure that you do not inject through clothing. You'll want to avoid injecting in areas where skin is tender, damaged, bruised, or scarred. Make sure you wash your hands with soap and water before cleaning the injection area you have chosen. Today, Andrea and Kyle are choosing to inject Kyle's right upper arm. Take an alcohol wipe and clean that area of the skin. Wait for the skin to dry and avoid blowing on or touching the area that you've cleaned. When you're ready to inject, carefully remove the needle cover while making sure not to bend the needle. You might see a drop of liquid at the end of the needle. This is normal. Throw the cover away in a sharps container. Never recap the Adbry syringe after you've opened it. Don't touch the needle or let it touch any surfaces. With one hand, pinch and hold around a fold of skin that you cleaned. With the other hand, you will insert the needle completely at about a 45-degree angle into the skin. Use your thumb to inject the medicine. Push down on the plunger head until you can't push it down any further. Now, lift your thumb off the plunger head. The needle will automatically move back inside the syringe and lock into place. If needed, you can place a dry cotton ball on the area for a few seconds, as there may be a small amount of blood or liquid where you injected. This is normal. If you'd like, you may cover the area with a small bandage. Nice job! Go ahead and dispose of the syringe in your sharps container. Any other materials, like your alcohol wipe, cotton ball, or bandage wrapper, can go in your household trash can. You're all done. Record the date of the injection on a wall or phone calendar. Also, be sure to record which arm you injected. This is so that next time, should you choose to inject in the arm again, you remember to inject in the opposite arm. If you do not choose to inject in the arm next time, you may instead inject in the thigh or in the stomach area, but not within 2 inches of the belly button. Please refer to the instructions for use found in your Adbry carton or on adbry.com.
If you have any questions, reach out to your healthcare professional or call 844-MY-ADBRY or 844-692-3279.
Remember that by signing up for the Adbry Advocate Program, you'll get access to ongoing support, including information on benefits, programs to help you save on Adbry, online resources, and so much more.
Indication and important safety information. What is Adbry? Adbry, tralokinumab-ldrm injection, is a prescription medicine used to treat people 12 years of age and older with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbry can be used with or without topical corticosteroids. It is not known if Adbry is safe and effective in children under 12 years of age. Do not use Adbry if you are allergic to tralokinumab or to any of its ingredients. What should I discuss with my healthcare provider before starting Adbry? Tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Adbry. Are pregnant or plan to become pregnant. It is not known whether Adbry will harm your unborn baby. There is a pregnancy exposure registry for women who use Adbry during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. You or your healthcare provider can get information and enroll you in this registry by calling 1-877-311-8972 or visiting mother-to-baby.org/ongoing-study/Adbry-tralokinumab/. Are breastfeeding or plan to breastfeed. It is not known whether Adbry passes into your breast milk and if it can harm your baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Adbry? See the detailed instructions for use that comes with Adbry for information on how to prepare and inject Adbry, and how to properly store and throw away, dispose of, used Adbry prefilled syringes and auto-injectors. Use Adbry exactly as prescribed by your healthcare provider. Your healthcare provider will tell you how much Adbry to inject and when to inject it. Adbry comes as a single-dose prefilled syringe with needle guard or as an auto-injector. Adbry is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injections of Adbry, you or your caregiver should receive training on the right way to prepare and inject Adbry. Do not try to inject Adbry until you have been shown the right way by your healthcare provider. In children 12 years of age and older, it is recommended that Adbry be given by or under supervision of an adult. If you miss a dose, inject the missed dose as soon as possible, then continue with your next dose at your regular scheduled time. If you inject too much Adbry than prescribed, call your healthcare provider or call Poison Helpline at 1-800-222-1222 or go to the nearest hospital emergency room right away. Your healthcare provider may prescribe other medicines to use with Adbry. Use the other prescribed medicines exactly as your healthcare provider tells you to. What are the possible side effects of Adbry? Adbry can cause serious side effects including allergic reactions, hypersensitivity, including a severe reaction known as anaphylaxis. Stop using Adbry and tell your healthcare provider or get emergency help right away if you get any of the following symptoms: breathing problems, itching, skin rash, swelling of the face, mouth, and tongue, fainting, dizziness, feeling lightheaded, low blood pressure, hives. Eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision. The most common side effects of Adbry include upper respiratory tract infections, eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia. These are not all the possible side effects of Adbry. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.